Hello, I'm Dr. Cathy Evans, and I, along with my colleague Dr. Sharon Switzer-McIntyre, are presenting this session, How Can Learners in Health Professional Education Programs Manage Test Anxiety? We've all felt it. Nausea, dizziness, pounding heart, cold, sweaty hands. These are signs of anxiety, a normal but nasty condition. Anxiety can be triggered by different stressful situations. One of the more common triggers for students in health programs is tests or exams. Now, some of the symptoms of anxiety are not pleasant, but they are manageable. But a major problem with test anxiety can be its effect on students' thinking ability. Anxiety can cause a student to blank out or cause their thoughts to race out of control. Students in health professional education programs are known to have higher levels of stress than students in non-medical programs, even though they start out with the same levels as their non-medical peers. Stress may harm learners' professional effectiveness, decrease their ability to concentrate, and trigger anxiety in test situations. So it's important to understand and manage the signs and symptoms of test anxiety. So in this session, we will discuss the causes, signs, and symptoms of test anxiety for health professional students and provide you with the research on some strategies to use before and during exams. What is test anxiety? It's normal and it's common. It's defined as feelings of tension and apprehension, worrisome thoughts, and the activation of the autonomic nervous system when an individual faces evaluative, achievement-demanding situations. Test anxiety appears to be associated with performance outcomes. In 2012, Matthew Owens from the University of Cambridge, in his research, suggests that worry about test-taking interferes with complex working memory and leads to lower test performance. Mark Chappell in the United States investigated the relationship between test anxiety and academic performance in 5,000 university students and found a statistically significant inverse relationship between test anxiety and cumulative GPA. In other words, the higher the level of anxiety, the lower the GPA for university students. But what about students training to be nurses, physical therapists, doctors, and other health professionals? This type of training appears to create high levels of stress. Medical students begin their programs with the same level of anxiety as their peers, but their anxiety rises each year, and the average medical student's anxiety level is in the 85th percentile compared to the general population.
Hi, I'm Dr. Sharon Switzer-McIntyre, and I'm going to continue with some strategies to use before and during tests. There are many things you can do during the school year to reduce test anxiety. In a 2013 systematic review, Dr. Regier highlights cognitive, behavioral, and mindfulness stress management interventions are effective. In 2006, Dr. Sansgiris suggested that test anxiety can be reduced using effective study techniques such as creating charts, outlines, and sample tests, as well as maintaining good time management skills and avoiding procrastination. Dr. Waterworth in 2003 showed that test anxiety can be reduced by using stress management techniques such as muscle relaxation, controlled breathing, and positive visualization. It is also important that you stay healthy while studying by eating right and keeping a balanced schedule that includes exercise, social activities, and a full night's sleep. Having a clear understanding of the course expectations is a helpful strategy to reduce anxiety. Make sure you read the course outline well before the exam and understand what the course expectations are, including the value of each evaluation, the type of exam you will write, such as a multiple choice, short answer, open book, and of course, it's imperative that you know the location, start time, and duration of the exam. When exam day eventually rolls around, make sure you are prepared. Eat a healthy meal and avoid loading up on caffeine. Arrive at the exam location early. Consider wearing comfortable clothing in layers so you can adjust your body temperature. Steer clear of stressful activities and people. Finally, choose a seat where you will be the least distracted. Avoid sitting near known weepers, mumblers, knuckle crackers, moaners, or the hottie that you had a secret crush on all year. When you turn that exam over, read all of the instructions. Flip through the entire exam and then reread the instructions. Make sure you are clear on what you are expected to do. During the exam, pace yourself. Work on the easy portions of the exam first to increase your confidence. For those tricky questions, write down the information you know, even if it's not entirely relevant. Avoid last-minute panic or time concerns by allocating time to each question or section. Some simple strategies to consider when you're writing exams can include developing an outline for essay-type exams to organize your thoughts and avoid rambling. Then fill in the blanks with information that relates to the questions asked. To tackle short answer questions, use the KISS principle. Keep it short and succinct. Only answer what is asked of you. With multiple choice questions, read the question and attempt to answer it before you look at the options. Then read all the options and eliminate those that you know are incorrect. If left with more than one option, watch for qualifying words like only, always, most, and never. These are usually the close to but not quite correct distractors. Reread the question and choose the one that best answers the question posed. If anxiety does creep in while you are writing, slow down and get control of your movements and thoughts. Use relaxation and visualization techniques that you have been practicing during your studying. Focus on calming yourself, perhaps through an inanimate object such as a good luck charm you have brought with you to the exam. Repeating a mantra, in your head of course, similar to relax, concentrate, I can do this, I know I am okay, has also been shown to help reduce test anxiety. After an exam, make sure you reward yourself for your hard work. Reflect on the experience and consider what made you anxious and what helped calm you down. Hopefully, we have helped you identify some of the causes, signs, and symptoms of test anxiety and provided you with strategies to use before and during tests. As a review, test anxiety is defined as the feelings of tension and apprehension, worrisome thoughts, and the activation of the autonomic nervous system when an individual faces evaluative, achievement-demanding situations. Remember, these feelings are normal and common. Identify what triggers your anxiety and practice the strategies that are highlighted here to help you reduce your anxiety when faced with taking an exam.